Welcome, everyone. This is Ashley Police. I'm with the Louisiana chapter of the American Academy of Pediatrics. We are so glad that you could join us today for the first of our 3 webinars on developmental screening. Today's webinar, Using the Developmental Screening Guidelines in Your Practice, will be given by Dr. Laura Thornton with the Bureau of Family Health. This webinar series is brought to you by a collaboration between the Louisiana AAP, the Louisiana Department of Health, and the Healthy Louisiana Plan. We have been able to secure continuing education credit for physicians, nurses, and social workers. As you can see there, the number of hours allotted for each professional credit. You will need to complete the evaluation survey after today's presentation in order to receive those credits. You will be emailed a link to that survey after today's presentation. It will also be shared with you in the chat box at the end of today's webinar. So I will like to introduce Dr. Laura Thornton. She is the Developmental Screening Coordinator with the Louisiana Bureau of Family Health. Laura, take it away.
So much, Ashley, and welcome everyone. I know that in the middle of all of our very busy schedules, it can be hard to find time to do continuing education and to learn about things that are kind of happening. So I want to say thank you so much for taking the time out of your day to be with us for around 45 minutes. And as you all know, in the world of Zoom and everything else, please bear with us if we have any technical difficulties today. We're trying out some new things, but rest assured, regardless of how things go today, we will have a video recorded session that will be available to review for continuing education in the future as well. So just as you may try and extend some grace to yourself, bear with us if we have any technical difficulties on our part. So what I'm going to do is start sharing my screen and we can jump into some content today. Feel free to put your name and location in the chat. That way it just gives us a little bit of a feel for who's in the virtual room with us and helps us kind of keep track of who all is here joining us today. So thank you so much for taking the time. And today we're going to be talking about how to use the Louisiana Developmental Screening Guidelines in your practice, how to get some help and support on that, and what that to kind of expect in the future on these webinars. I will kind of try to whiz through all of this. Ashley Politz did a wonderful job of introducing this and getting us started, and I am really appreciative to the LAAAP's work in collaboration in all of this. And I am indeed Laura Thornton. I am a developmental psychologist by training. I serve in the Bureau of Family Health, which is a part of Louisiana Departments of Health Office of Public Health. So in a department, in a bureau, and all of those things. And I also serve as Louisiana's Act Early Ambassador for the CDC's Learn the Signs Act Early campaign, which is all about promoting developmental promotion and screening in particular. So you may see or hear me around on various topics. And importantly, we have nothing to disclose in terms of conflicts of interest. So want to make sure we get that out of the way. And then continuing ed, we have been able to get continuing education credits for physicians, nurses, and social workers. The key component there is that we will need your evaluation from today. So make sure to complete that evaluation so that you can get your CE credits, because we all know how that goes. So let's kind of start diving into what is the Louisiana Developmental Screening Guidelines? What is its history? What do we need to kind of know? And why have anything beyond what the AAP recommends? And for a little bit of a background, and one of the things that we wanted to bring to folks' attention is that there is a cross-sector group called the Young Child Wellness Collaborative. And this was formed in 2015 and includes people from all different sectors. So we've got folks from Medicaid represented, we have early intervention, we have public health, we have education, we have folks from the governor's office, we have physicians. So we want to make sure that it is a well-rounded group of folks, and it's all of the folks who are invested in making sure that children are healthy. And in particular, one of the things that we know happens simultaneously is that AAP always has their clinical and policy reports that outline when things should be happening. We all know that periodicity chart that tells us when things should be happening at what time. What AAP also does is often provides a list of typically very reliable and often validated tools that are kind of listed out for the provider. But it doesn't say, hey, this one works really well in this particular subsample, or here's where it's been validated in more information. So we know that our Louisiana children and families may need a little bit more information. And so to try and make that a little bit easier for folks, we wanted to identify what screening tools to use in Louisiana populations for Louisiana children and families. And that was really where the Louisiana Developmental Screening Guidelines in 2015 came from. And so it was really identifying what tools to recommend for folks. And because we know social, emotional, and social determinants of health can be assessed kind of consistently throughout that birth to 5 period, that there wasn't a strong periodicity recommendation from the AAP. And what the Louisiana Developmental Screening Guidelines did was outline that a little bit more clearly so that folks have a good recommendation of, okay, this is when I should be doing it, and highlighting those as particular needs for our Louisiana children and families. So that kind of brings about how these original things formed, and you may have seen them on LDH websites or things along those lines. But in 2020, we went through an update process, and this was to reflect the updated AAP guidelines, so the new periodicity that came out there, and going along with all of the evidence that grows over the course of time in the scientific literature. We know new things get developed. We also know that things get validated in different populations and that things may change. So through this process, we had a working group of folks who were, again, from all different sectors, making sure to invite pediatricians, including our developmental behavioral pediatricians, that we had social workers and nurses and psychologists and folks who are invested in all of this and know what is going to be reliable and valid in particularly our population. So we went through a variety of different things, and I will go through that process a little bit more in depth here in a moment. But all of this to say that there are updated guidelines, and we will drop a link in the chat of where you can find a report on this update process specifically. You can see the exact guidelines in a variety of different places on the LDH website. But if you're really interested in the nitty-gritty of knowing, all right, you looked at this, you looked at that, what are the psychometric things that you looked at, all of those different components, you can read more about it there. As a psychometric and measurement nerd, I was very happy to be a part of all of that, but want to make sure that people have the opportunity to learn more about it if you are interested. So all of this to say that there are some new updated guidelines to make these clear recommendations of, all right, we know we need to do general developmental screening. We know we need to do autism screening. We know we need to screen for depression in new parents, but what tools specifically should we be using? And then in addition to that, when we're thinking about the social emotional health and social determinants of health, or now barriers to health, what should we be looking for in terms of good tools that will be reliable and have demonstrated validity in samples either in Louisiana or samples that are very similar to Louisiana? Because again, we know that the kids in our families here face unique challenges, and that we want to make sure that all of our screens are going to be reflective of that and have good clinical utility. All right. So going into what are the current recommendations of the Louisiana Developmental Screening Guidelines. So what you can see here is that for general development, autism, and perinatal depression, our recommendations are exactly in alignment with the American Academy of Pediatrics / Bright Futures guidelines. So for general development, this means 9, 18, and 30-month screens that need to happen, and particularly for autism, that should happen at the 18 and 24-month visits. Third, we have the perinatal depression, which should happen at the 1, 2, 4, and 6-month visits. And one of the things that changed from previous versions, and to be in alignment with the AAP's language of using perinatal depression to indicate both perinatal and postpartum depression to be screened, and the fact that it should also include non-birthing parents. So anyone who is a caregiver for an infant should also be screened. Some things that I will also highlight when we're looking at these 3 domains in particular is that all of the questions that I imagine you all have around Medicaid policy and reimbursement and billing and coding and all of the things that go along with that will be more thoroughly addressed in next week's webinar. We have an entire section or entire webinar focused just on the Medicaid policy from Dr. Amanda Dumas, who is the Associate Medical Director. And so we're going to let her and her expertise be able to shine some light on that a bit more thoroughly. So I know that for many folks, that is a lot of reason why there's a lot of interest, but that will definitely be addressed the next time around. But indeed, these 3 are now being reimbursed for. We'll also drop a link to the specific bulletin that outlines how Medicaid announced that they were going to begin reimbursing for this, dating back to January 1 of 2021. So just want to highlight that part, that I know for a lot of folks that is a main interest, and that we want to acknowledge that while we may not be able to give you all of the answers today, hopefully we can answer some of your questions around Medicaid next week. So put it in your schedule, calendar, all of those good things, and join us next week as well. So we're at the Louisiana Developmental. Go ahead.
I was just saying, Laura, there are a couple of questions if you want to take them now before moving on to the next component. Casey Park asks, is the Denver Developmental Questionnaire still a good tool to use?
That is an excellent question, and we will be jumping into that when we get to our recommended tools section. And indeed, the Denver is no longer being published. So we will definitely discuss that one here in just a moment.
All right, and one more. What if a screening is done at the age, what if a screening, is not done at the age that is required? You would do an audit on developmental screening and you see this was not done. Will the provider potentially be dinged on their audit?
Got it. So in terms of particulars around auditing or chart review, I cannot address that as to the specifics of within Medicaid policy or within your hospital or systems policy. However, if you are a provider who doesn't have documentation of previous ones, or it's a new patient in, you're not getting those records that come along with it, it's okay to go ahead and then screen as soon as possible. So the nice part about a lot of the screening tools that we recommend is that they're either available or have specific screenings beyond those particular time points. So when we jump into the general development screening in particular, the Ages and Stages questionnaire does have relevant screens for 9, 18, and 30 months, but it also has screens of as early as 2 months and up to 5 years. So you can utilize the tool across that time period and do whatever is most up to date on that front. And we'll go into that a little bit further, again, when we jump into the recommended tools. But really excellent question. While I can't address it specific to Medicaid policy or to perhaps your systems policy, if you have a new patient and don't necessarily have that previous information, go ahead and do a screen, particularly around general development, if they're establishing care. I hope that helps answer a question. I know this can be challenging and there are so many nuances to all of this. So excellent questions so far. All right. So from here, where the Louisiana Developmental Screening Guidelines go a little bit further than the AAP's recommendations is one in the social emotional domain and barriers to health. So social emotional and social determinants of health / barriers to health are in the AAP policy have been indicated that they can essentially happen at most supervision visits, particularly in these birth to 5 years. And given that, we wanted to highlight the times at which there are good, reliable, well-validated tools that are in samples that are similar to our population that can be used. And so for social emotional, we highlight starting at the 18-month period, because this is often as early as many of the social emotional developmental tools, particularly for screening, are available. And then continuing screening at 30, 36, 48, and 60 months. This does not mean in any way that social emotional development should be ignored, and I know you all aren't ignoring them before 18 months. It means that relying on developmental screening checklists, developmental milestone checklists may be particularly useful. And indeed, the general development screens like the Ages and Stages questionnaire include a social component as well. And then change the language of social determinants of health to barriers to health to reflect the fact that barriers can be removed or surmounted through both systematic and individual changes, and that these are things that need to be assessed really frequently in these first 5 years. And part of this is because one of the tools that we recommend within the barriers to health includes perinatal depression screening. So that's one of the reasons why we recommend it happening several times within that first year at the 1, 2, 4, and 6 months. And then again at 12 months, and then consistently each year after that. So doing it several times within those first 6 months of life, and then yearly beyond that, just so that you have a good idea of what kind of the environment and experiences the infant and family are going through. So I see a couple of other questions have popped up, but I cannot currently see them. So Ashley, do you mind reading those out for us? If they're
sure. It says, is there a breakdown of the questions that should be asked for each domain?
That is an excellent question. And I'm hoping in our recommended instruments section that can give you a better idea of what kind of breadth that we are looking for in terms of the recommended instruments. So I'm hoping that this can provide a little bit more context for you. Excellent question.
And Laura, our question bank is clear.
Cool. All right. So in terms of what in general are we recommending? In general, I will give you the overall statement that while we recommend these specific tools because they're easy to use, either relatively affordable or free, this does not mean that these are the only tools you can use. These are not the only tools you can use. Medicaid policy that we'll cover more next week indicates that as long as they were generally listed in the AAP clinical policies, that those tools are allowable. However, this is the kind of easy, we've done the thinking and analysis for you to try and make it a little bit easier when trying to choose for your clinic or system what tool you want to use. So for general development, we recommend the Ages and Stages Questionnaire 3rd edition. While there is currently a 4th edition in the works, it is not out yet. And so that is why we're not going to recommend something that's not out just yet. It's well-rounded, pardon me, and covers a variety of kind of domains. So it includes social emotional components. It includes other things just beyond movement or physical development. So it's well-rounded, it's been well-validated and researched in populations similar to Louisiana. And because of that, that's the primary reason why we recommend it. And it also has some good interfaces with our electronic health records. And I need to cough and take a sip of water. So bear with me one moment while I go on mute. All right. To address the question around utilizing the Denver, while the Denver in full often has a lot of training that can go along with it, it can often be a longer clinician administered screen. And in general, the AAP has moved towards parent completed screens. And so all of our screens are also in alignment of that this isn't something that you as the clinician would fill out. If anything, would be filled out in partnership with a parent. If there is reading concerns and anything along those lines. However, everything here should be able to be completed by parents as well. So just want to address the question around the Denver, because we know a lot of people were trained in it. But given that it's no longer in print and currently doesn't have any research or validation going towards that, we are not currently recommending it at this time. Again, that doesn't mean that Medicaid may or may not reimburse for it. I can't speak to that. It's just that our primary recommendation would be for the Ages and Stages Questionnaire. We also are not sponsored, or we aren't getting any benefit from that in any way. So I want to pause there and ask if there are any questions specifically around general development recommended tools.
Laura, there's a question in the chat box about the MChat, if you wanted to address that.
Awesome. So indeed, the MChat is our recommended tool for autism screening. Let me see if I can find that question.
It was simply if you could talk through if the MChat was one that was recommended.
Got it. I apologize. Couldn't see that one. Yes. So the modified checklist for autism in toddlers revised with follow-up edition of the MChat is one that we recommend. So historically, the MChat original one had several items and addressed autism specific questions, and the revised version helped clarify that a little bit more. But the revised version with follow-up is the one that we strongly recommend, because the first 20 items of the MChat are really good at indicating any potential risk for autism, and that includes maybe having problems with hearing. And so the creators developed additional flowcharts that walk through all of the potential things along with each item. So when you are scoring this MChat RF version, if you have kind of a score that's somewhere in between, and that it's not clearly a no risk identified, or is not a, yep, there is very clearly risk identified, meaning 7 or more, if it's anywhere in that kind of 3 to 7 items endorsed range, there are the follow-up flowcharts, which help kind of walk through all of the potential ways that a child may be demonstrating or not demonstrating risk for autism. So because of that, it helps reduce those kind of false positives. Because I know that is often kind of a concern of some folks, is that it's relatively easy to, if you are going through the MChat in general, to identify risk. However, the follow-up flowcharts really kind of provide a lot of different options and go through those together to find whether a child is actually exhibiting signs or symptoms of autism. And while obviously it's not diagnostic, it helps reduce some of those kind of false positives in general. So absolutely, we recommend the MChat, particularly the revised with follow-up. Again, one of the wonderful things about it is that it is free online and has been translated into several different languages as well. So excellent question. And if you are wanting to know more about this and any of these given topics, you can check out our developmental screening toolkit online, which we will include links to throughout and cover a little bit more in a moment. For perinatal depression, we recommend the Patient Health Questionnaire 2 or PHQ-2. We also recommend the PHQ-9 in case you just want to go ahead and get all of those 9 questions out of the way. And then we also recommend the Safe Environment for Every Kid, or SEEK. And what is nice about the SEEK is that it includes the PHQ-2. And the reason that we include that in perinatal depression is that you will also see it later in the barriers to health domain of tools that we recommend. All of, for perinatal depression, both the PHQ-2 and PHQ-9 are free and widely available. The SEEK has modest fees that are entirely scaled upon the size of your practice and depending upon whether it's used in a training environment. So for social emotional screening, we recommend the BRIEF Early Childhood Screening Assessment, or BRIEF EXA, which is free and available online, and the Ages and Stages Questionnaire Social Emotional Second Edition. So as a part of the Ages and Stages kind of assessment battery, they also include a social emotional specific one. And those are our 2 recommendations for that one. Last but certainly not least is our Barriers to Health, where we recommend the Safe Environment for Every Kid, which includes those perinatal depression questions, and then the survey of well-being of young children, specifically the family questions. And this is freely available and is around 10 items as well. So overall, we try and provide tools that are either free or very affordable, and have a demonstrated evidence base in populations that are very similar to Louisiana, if not in Louisiana themselves. I know that folks can have lots of questions about all of these things, and we highly recommend checking out the Louisiana Developmental Screening Guidelines Toolkit website, which you can find at the Bureau of Health's website. We will also drop that link in the chat just now. And to give you a little bit of an idea of what you might find in our toolkit, you, in general, at the top of every page, will see a way to get to the home page of the toolkit. And in general, we break down how to implement any kind of screening within this birth to 5 period, focusing on those 5 domains that we listed into steps, and then provide some additional help. So 1 is really focusing on assessing and creating a plan. 2 is training your team, including yourself, making sure that everyone knows what they need to do. And 3 is implementing that plan and putting it into practice. And we know that implementation can be challenging, and especially in our currently COVID world, it is extra work and effort that is often required. So we provide additional training and support beyond what you see just in the toolkit. And I will talk about how to access that in a little bit. And then all of the resources that go along with this. We know that folks don't want to screen if they don't know where to refer to. If you're identifying risk for general development or social emotional development or autism, you want to know where to connect those families next. And so all of our resource pages, or page in particular, will outline the most frequently referred places on kind of each of those items. And we have additional tip sheets that help walk you through, and you can share with families of how to find apps that may help in the meantime, or where to learn more about autism and things along those lines. So it really just kind of covers the gamut, and we try and answer as many questions as possible. And our training and support can be really different depending on what you in your practice want and need. This ranges from anywhere from initial planning of, hey, we know things are reimbursable now. How do we make this happen? Because we've been doing X or Y or Z, or we haven't been doing it at all. How do we make this a reality for us? And we walk through that process of figuring out what your clinic already has capacity for and where we can build on those strengths together. And it can also be direct one-on-one coaching, where we walk through all of our worksheets together of, all right, we need to figure out this question, this question, this question. We need to figure out what that process flow is going to be like in your day-to-day clinic rooms. And we will walk through this with you and provide support, currently all on Zoom, but it works around your schedule, and we are here to help make that happen. And last but not least, you can always email us. Email devscreen@la.gov, and we will get back to you in about 2 business days, if not earlier. And this can be general questions around, hey, I'm not sure about this or X or Y, or hey, I would like to set up that initial planning meeting because I need to figure out how to make this happen in my practice. So all of those things can be done there. You all also already found our webinars, so excellent work. Whether it came directly into your inbox or you found it through our training and support website. We'll also host office hours every month following this initial webinar series, where we talk about kind of different strategies or topics that are particularly relevant when implementing developmental screening in your practice. So that is kind of our big spiel of what the developmental screening guidelines are, how to find some support and help and information on that in particular. So from here, we will jump to our Q&A. And we've been able to answer some questions initially, kind of throughout, but happy to answer any additional questions now.
So Laura, there's a question, postpartum anxiety is a high stat as well. Why is the GAD-7 not done as a screener?
That's an excellent question. And indeed, perinatal anxiety and depression often co-occur. We know that anxiety and depression co-occur together. Because the AAP has not specifically outlined perinatal anxiety in particular, that is one of the reasons why we do not have an additional domain of perinatal anxiety as a domain that is recommended, because that goes a step beyond, given that it hasn't been identified or outlined very specifically in the clinical policies by AAP. However, if there is ever a suspicion or a concern, absolutely it should be screened and monitored. But as of right now, it is not within that those 5 domains currently. But if it's a concern, if a birthing person is coming in and says, I've got a history of anxiety, okay, what are we doing to mitigate and monitor that throughout the pregnancy? And it's a wonderful thing to establish with new patients when they're coming in, and talking about that can really be helpful in destigmatizing as well. So unfortunately, it's because we're comfortable going a little bit farther than the AAP in terms of social, emotional, and barriers to health. But it is also because they have already explicitly said in all of those fun little footnotes in the periodicity that social, emotional, and barriers to health can be assessed pretty much consistently throughout that birth to 5 period, but hasn't been done just yet for perinatal anxiety. Awesome question, though.
So 2 more questions here in the Q&A. For the ages and stages questionnaire, do you think it's beneficial to do this at 3 recommended ages and in between to use a simpler screening tool for other well-child visits, especially given the patchier care that we've had during COVID due to family fears? It's an attempt to catch a concern early, or should we do ages and stages alone?
So if I heard and processed that all right, which can not necessarily be accurate, the question is whether we do say you do ages and stages at 9, 18, and 30 months, but you're using something else in between. Is that an accurate reflection, Ashley?
I believe so.
Okay. Yeah, those are excellent ways to continue to monitor the ages and stages. Also, if you are going ahead and utilizing that, they have specific screens across those different ages as well that are going to be in between. And so it's important whether this is the bare minimum of when we're saying that screening should be happening at minimum 9, 18, and 30 months, or 18 and 24. So if you are doing them in between, that's wonderful. And again, next week we'll be able to address the Medicaid policy questions about reimbursement for those kind of interperiodicity screens, but also at the same time doing the general developmental checklists. Milestone checklists are a great tool to do that every single time, to check in where kiddo is at, and to check in with families as well. And that's generally something that families like too, in what we have heard reported back to us. But it's an excellent practice, and indeed, these recommendations are the bare minimum of when we think they should be happening. They can happen more often than that, though.
Great. So 2 more questions as we wrap up. Number 1, what about the Edinburgh Postpartum Depression Scale? And number 2, can staff members ask the screening questions or physicians only?
Awesome questions. So we love the Edinburgh. It is an excellent tool. One of, I would say, primarily the only reason that we did not include the Edinburgh is because it's focused on postnatal. And because it focuses on specifically just on that period, we wanted to make recommendations of tools that can be used throughout that entire perinatal experience and work for non-birthing partners as well. So if it is a non-birthing caregiver you're also screening for depression, it's a little bit easier to use the PHQ-2 or PHQ-9 compared to the Edinburgh. But the Edinburgh is an excellent tool, and we really like it. It's doesn't meet the can be used and is completely relevant throughout that entire perinatal period and whether that person has given birth or not. So those are the only reasons why it's not included, but excellent tool, highly recommend it. We know that in general, it is a good one. So, and then the second question of, can other staff members do this? And can your MAs introduce this or complete them with your families? Absolutely. It does not have to only be a physician or an MD or a DO who's doing this. It can be anyone throughout the entire clinic. Often we recommend that maybe if it works in your clinic, maybe it's the front desk who's handing it out and introducing, and then going into the back room and having an MA or nurse also discuss this. So excellent questions overall. I know we are coming up on time though, so I'm gonna stop talking. And from here, just a reminder that next week we are gonna be talking about Louisiana Medicaid policy and screening, and we'll be here same time. You will receive more information on all of our continuing education stuff in your email. And I am going to stop sharing.
Thanks, Laura, so much for that presentation. I think we have all learned a lot. I appreciate all of you staying on for this full time. In the chat box, there is a link to the survey evaluation as well as registration if you aren't registered yet for next week's training. Following today's presentation, within 3 days, you will receive a copy of the presentation today, a video recording of this webinar, as well as a list of all the helpful links that we shared through the chat box and that are part of the presentation. I know there were a few folks who left questions that we didn't get to. I have copied those, and we'll do our best to get those answers submitted to you as well. So with that, have a wonderful day. We hope we see you next week. Thank you so much.